Hello, everyone. Thank you so much for coming to the session and attending. We truly appreciate your presence here. When CDC, US CDC, Centers for Disease Controls, looked at all the development factors that really improve the health in the United States, CDC found that and identified family planning is one of the top 10 most best health investment they made to improve the health in the United States. Now, family planning has been all the time been presented as a population control issue. But again, this is not a population issue at all. This is women issue, women's health issue, and this is absolutely, I really consider family planning as a sort of like a vaccination for women, preventing their death, improving their health, and also preventing the child mortality. So we just published a paper in the Lancet Global Health, and I have given a copy in your table, and that's essentially looked at the effect of the maternity care, improvement, fertility decline, and contraceptive use on global maternal mortality education, maternal mortality reduction. And that paper really came out on November 3rd. And primarily the finding of the paper, I want to make it very highlight the finding. And that really study shows that the very first thing we done in 2012 at the launch of AP23 or the family planning program that was launched in the UK. In that one, we really shown this paper in 2012 in the Lancet that the maternal mortality was reduced by the contraceptive use almost like a 44%. And if we can really additionally meet the unmet need, that will reduce additional 29% of the maternal death. As a follow-up of that study, the new study has essentially shown, we try to examine the effect of maternal mortality reduction between the 2000 and 2023. So over the 23-year period, what is the contribution of the family planning and fertility reduction compared to the maternity care? And some of you may know, when the Safe Motherhood program was launched in 1987, family planning was recognized as one of the pillars of one of the 4 pillars of the Safe Motherhood program. And what we really find, this paper essentially has shown that the mortality reduction, almost like a 40% reduction, maternal mortality reduction has occurred between 2000 and 2023. Of that 40% maternal mortality reduction, 61.2% of the maternal mortality reduction was due to maternity care improvement. And almost like a 39% was due to the fertility reduction. Just think about it. And think about the cost issue. Okay, how much you really invested in reducing one maternity death through the contraceptive use and through the maternity care. And we also had additionally examined and found that just by increase of the contraceptive prevalence during this period of time, also essentially some sort of like reduced like a 77,000 maternal death. If anybody is familiar, in 2023, the number of maternal death was 260,000. So instead of the 260,000, additional 4,000 deaths would occur if the contraceptive would remain at the same level. Just think about it. And this has shown, if you look at this column and this column, this is shown the maternity effect, and this is shown the contraceptive, the fertility reduction effect. And you can see that many regions, even in the top line is showing the world and other regions, you can see the most of the regions, particularly the sub-Saharan Africa, Latin American countries, extensively benefited from the improvement in the contraceptive use. Okay. The next slide I will show you is essentially show anybody working in the family planning also must recognize that how much inequity has been reduced and how much improvement has occurred also in the poor families, in the poor women, in improving the contraceptive use. So this was done by the next generation and outstanding scientists. I asked her before the meeting that, are you going to present this result? She said no. And she was responsible for selecting all the papers that were presented. So I said, okay, fine. If you don't present, I will present it, considering that the importance of this paper in addressing the inequity issue, which is critically important. Everybody should know how the family planning program has improved access to the contraceptive method to the poor women and the poorest of the poor women. And this was done by Carolina. Okay? So this is the paper. I really, really want anybody interested in family planning, anybody working on the family planning must read this paper. This is critically important. You must know this paper. And if you look at it, this paper has shown all the inequity that has been reduced based on the last 20 years, almost like the last 20 years. So I will stop there. Thank you.